Hi Jane, how are you?
Hi, I'm good. How are you?
I'm good. Yeah, so let me introduce myself. My name is Rabnawaz, and I'm working as a case manager at Australian Care Foundation,
Yeah.
which is based in Auburn. And let me tell you, in today's session, we'll be discussing about your case. Is that okay?
Yeah, that's okay.
Yeah. Are you comfortable to share your all issues from the beginning? It is very important for me to understand your case in better way. I'll be like asking you all the information which you think is important for you to share with me. Uh, you will have to share all your information with me. Is that okay?
Yeah, I think it's okay, but I'm not used to sharing like a lot of things to like everyone, but I can still try.
Yeah. Let me tell you one thing. Whatever information you will be sharing with me, it will remain confidential between you and me.
Mm-hmm.
Uh, well, I might have to share your like thoughts and your things with someone else, like my supervisor or someone else, in case during our session, if I felt like you are in danger of harming yourself or someone else. In that case, I'll be sharing your information with my supervisor or with the higher authorities. uh, that's called mandatory reporting, and that's my job, because your life is our first priority. So in a case, if I feel somewhere at certain stage, if I feel that you are in danger of harming yourself or someone else, in that case I'll have to share your information with my supervisor or higher authorities. Is that okay?
Yeah, that's okay.
Yeah. So Jen, during today's session, I'll be taking some case notes.
Mm-hmm.
I have to inform you about these case notes. You don't have to worry about them. These case notes will remain with me. And like as I said, as I told you about confidentiality, these case notes will remain uh, as a private notes between you and me. At the end of session, if you want me to share these notes with you, I can share these notes with you. But I can assure you that these notes will remain with me just to understand your case in a better way, and to assess your case at the end. So is that okay?
Yeah, that sounds good.
Yeah. So Jen, tell us about yourself.
So I'm 34 years old. I'm a mom. I have three kids. I have one of my oldest kid is 12 years old. My middle kid is 10, and my youngest is 2 years old.
Yeah. So tell me about your past and like your history.
Actually, I have some personal childhood trauma history, and I spent most of my childhood in like foster care, and later on in refugee camps for both homeless and domestic violence. And later stage, my partner used to abuse me physically and mentally, which is like a bit traumatizing for myself. As you know, like as I told you that I've been living in a foster care. After that, I've been like living in a refugee camp, and I've been like with a very abusive partner. It's like a bit traumatizing for me. So I have been like taking, I have a history of taking drugs, and also have been like out for rehabilitation.
Yeah. So what about your job? Like, are you currently employed, working somewhere at the moment?
Um, I had only one job in my life, which was a cleaner job. I'm no longer employed and currently receiving money from Centrelink. As I told you that I would like to work, but at the moment I'm not working.
So where are you living currently?
Currently, I'm in living in a short-term crisis accommodation.
So, as you mentioned earlier that you have three childs,
Mhm.
what about your childs? They are living with you or they're living somewhere else? Can you tell me something about them?
So my two eldest child, they have been placed in a long-term foster care until the age of 18. And then my youngest child, he is still living with his relatives at the moment.
Yeah.
Mm.
Jen, can you tell me like why your two childrens were taken away from you? What was the reason behind that?
I have because as I told you that I have been like in rehabilitation for a while, and I've been like using drugs in my like past, and then that's why I've been demonstrated an inability to adequately care for them. So that's why I had to leave them like somewhere else where they can be safe. Yeah.
Yeah. So, Jen, how often like do you contact them, like your children's?
Actually, I haven't contacted them for last, I think, 6 months. I haven't been like in contact with them at all.
Jen, as you said, like to your children, they are staying at foster care. And then what about your younger children, younger child? Tell me something about him, like where he's living at the moment.
Yeah, before he, like when I used to be in the rehab, he used to live with my relatives for a certain while. But as you know that, like it's hard for the expenses and everything. So now he's in foster care on a 2-year order, the Department of Child Protection, and they are open to work with me, and they have like asked me to demonstrate that if I can safely parent. And he's still young, and they have asked me like if they can consider unification, if I can demonstrate I can safely parent. So I'm already out of rehabilitation. It's been a while. So I'm just working on myself so that I can like take good care of my youngest one. And yeah, that's what I'm like planning to do at the moment.
Jen, that's great if they are at least giving you opportunity to reunite with your child. It's good for you and for your child as well. Regarding that, are you in contact with the Department of Child Protection? Like, how often do you meet them, or how often do you contact them over the phone?
Normally they do contact me, but currently due to frustrations issues that I have been like going through, it's really hard for me to like have a conversation with anyone at the moment. So I have been like really avoiding their calls, and I'm not attending their appointments as well. I'm like kind of verbally abusive, like I have a habit of like verbally abuse a lot, which like I feel I've been doing with the staff as well. Yeah.
I can understand your situation, Jen, and I can feel that it's so frustrating for you. And hopefully we'll try to get you out of this situation as much as like as early as possible. But
Mhm.
both of us we have to work together to get you out of this situation. uh, you know that, right?
Yeah.
Yeah.
Yeah,
So
I'm looking forward to it.
tell me something about your family of origin. How often do you contact them or meet them?
Well, I don't have any contact with my family of origin, to be honest.
When was the last time you contacted them or you met them?
As I told you, like I've been into foster care since my childhood, so I haven't like actually met them. Yeah, I don't even remember when I met them last time.
Okay, Jen. So you have been referred to me as you have recently completed your detoxification program, and now you are linked with post-detoxification outpatient drug and alcohol services for ongoing case management. So regarding that, what do you expect from us? Like, what are your needs and what are your requirements from us, and in which way you want me to help you.
Actually, I would like to try and get my life back on track in terms of maintaining like drug-free lifestyle, and I would also like to get a stable job and a stable accommodation. I would love to be in contact with the Department of Child Protection as well, so that I can get the custody of my younger child. As you know, like being away with your child is hard, and then so that I can resume my contact with my other two children as well.
Well, thank you so much, Jen, for sharing your whole life journey. I can feel your pain, and I know it's very frustrating. I'm always here to help you. I can feel your pain, as I know it's very difficult to stay away from your kids. So let's work together to help you out in this painful situation. Is is
Yeah,
is that okay?
thank you so much for saying
Yeah.
that.
Uh, Okay, Jen. So for drug-free lifestyle and recovery program, I will refer you to a non-profit organization. But as you know, that sometimes recovery phase can take years and years. So I can recommend you to contact a non-profit organization named William Booth House Recovery Services. They work under the Salvation Army,
Mm-hmm.
and the services they provide is residential withdrawal management and rehabilitation for men and women. They are located in Surrey Hills, New South Wales. I'll be sharing their contact number with you as well. And at the end of this session, I'll be in contact with them and I'll inform you about your case, and they will book you an appointment as soon as possible. Is that okay with you, Jen?
Yeah, that should be okay. Yeah, that sounds good actually.
Yeah. And then, based on your goals of maintaining a drug-free lifestyle, obtaining stable housing and employment, and regaining custody of your child, your case plan, I've included few things in your case plan. At first, will be like having individual counseling session. Is that okay for you?
Yeah, that's okay.
And then we'll help you with the resume building. We'll try to help you in your CV, and in that way, it will be easier for you to like get a job. Is that okay?
Yeah,
Yeah. And then regarding custody of your child, we'll be connecting you with the legal resources to navigate the process of regaining custody of your child and addressing any legal issues related to your substance use, coordination with the child protection services. Is that okay?
yeah, that sounds good.
Okay, good. Okay, Jen, then we'll be meeting next Thursday again to discuss your case further again. During this time of period, if at any stage, if you feel like you need any kind of help, you can contact me, and I'll be sharing my email and my number with you as well. So once again, thank you so much for the sharing your all the thoughts and all the issues with
Mm,
me, and I can like promise you that we'll be working together to solve, to help you get your issues resolved, and we'll try to work together, and we'll try to help you to get out of your situation as soon as possible. So,
yeah,
and do you have like any question?
no, no further questions. Thank you.
And thank you so much, Jen. It was lovely meeting you, and thank you so much. I'll see you again on Thursday. Thank you. Bye bye.
See you.